Introducing Central Nervous System CNS Lymphoma. Central nervous system lymphoma is a rare yet deadly non-Hodgkin lymphoma. Non-Hodgkin lymphoma is a type of cancer that originates in lymphocytes, infections-fighting white blood cells that make up your immune system. In CNS lymphoma, cancerous lymphocytes can either amass in the brain and spinal cord, or spread to CNS from other sites of lymph tissue in the body. Functions of the B cells. The immune system is made up of two armies of cells, innate and acquired. Innate immune cells are the body's first line of defense. Our acquired immunity, also called as adaptive immunity, uses T cells and B cells by invading organisms that slip through that first line. These cells take longer to develop because their behaviors evolve from learned experiences, but they tend to live longer than innate cells. B cells and T cells are also called lymphocytes. B cells are activated by the binding of antigen to receptors on its cell surface, which causes the cell to divide and proliferate. Some stimulated B cells become plasma cells, which secretes antibodies. These antibodies are made up of proteins. These proteins help to fight your body against germs such as bacteria and viruses. When you have B cell lymphoma, your body makes too many abnormal B cells. These cells can't fight infections very well. They can also spread to other parts of your body. Therefore, there are two types of lymphoma. The first one, Hodgkin lymphoma and non-Hodgkin lymphoma. Most B cells lymphoma are non-Hodgkin lymphoma.
The pathophysiology of central nervous system lymphoma. Central nervous system lymphoma begins in the nervous system and is confined to the brain, spine, cerebrospinal fluid, and eyes. The central nervous system lymphoma may present either as an isolated lesion or as a combination of the following features: discrete or diffuse intracranial lesions that are either solitary or multiple, ocular lymphomas with or without other lesions, and leptomeningeal surface and spinal cord lesions. The central nervous system lymphoma shows a characteristic angiocentric pattern forming cuffs of tumor cells within and around cerebral blood vessels. Reticulin preparation shows concentric reticulin fibers around blood vessels. The tumor infiltrates the brain parenchyma as small clusters and as individual cells. The tumor may show areas of necrosis with viable cells found mainly around blood vessels. Most central nervous system lymphoma cases involve diffuse large B-cell lymphoma. Diffuse large B-cell lymphoma is an aggressive non-Hodgkin's lymphoma that affects B lymphocytes. Lymphocytes are a type of white blood cells. B cells are lymphocytes that make antibodies to fight infections and are an important part of the lymphatic system. Diffuse large B-cell lymphoma arises from mature B cells at different stages of differentiation. Several gene mutations promote changes in B cells, changing the gene expression and promoting a neoplastic transformation. During B lymphocyte ontogeny, after leaving the bone marrow, those cells travel to secondary lymphoid tissues where they will find their respective antigens, promoting the development of secondary follicles. An antigen-dependent phase of B-cell development occurs at this site. The causes of central nervous system lymphoma. So far, research is unable to determine the exact causes of central nervous system lymphoma, but so far, some common causes have been underlined is a weakened immune system by immune disorders such as AIDS, for example, or patients that use drugs to suppress their immune system following an organ transplant or immunosuppressive treatment. The majority of HIV patients are Epstein-Barr virus related. The most likely etiology is ineffective immunoregulation of Epstein-Barr virus, inducing oncogenic protein expression and subsequent loss of apoptosis and increased proliferation of lymphocytes. The effects of central nervous system lymphoma. Central nervous system lymphoma may disrupt virtually any aspect of normal central nervous system function depending on the location of the tumor. Central nervous system lymphoma most commonly involves the cerebral hemispheres, followed by the basal ganglia, corpus callosum, and cerebellum. Central nervous system lymphoma less commonly arises in deep brain structures such as the brainstem and spinal cord. Central nervous system lymphoma tumors are typically in contact with cerebrospinal fluid spaces. Involvement of the brainstem, which connects the brain and spinal cord, can lead to gait imbalance, vertigo, impairment of eye movements, and intractable vomiting. Spinal cord involvement is rare in central nervous system lymphoma.
Person with CNS lymphoma will exhibit symptoms include muscle weakness, not the whole body, only in certain areas such as arms or legs. Loss of sensation. In this case, it's more the loss of touch sensation or feeling of numbness in certain areas similar to muscle weakness. Changes in vision or a partial loss of vision. Headache. Sudden seizure in which a person's body is having a short period of uncontrollable jerking, like being electrically shocked. Nausea, and the next thing you know, vomiting. And lastly, body imbalance. A person walking across the room or down the block requires good balance. Thus, you know what you face having this symptom.
Treatments such as radiotherapy are usually used by patients who has primary CNS lymphoma. This targets the whole brain. This is also known as whole brain therapy. Radiotherapy can be very useful for people who are unfit for chemotherapy. Also can be used in patients with low-grade lymphoma. Radiotherapy usually lasts for 5 days a week for over a duration of 2 to 4 weeks. The second treatment is known as steroid therapy. The common steroid used for CNS lymphoma is dexamethasone. Dexamethasone are given orally, which is by mouth, or intravenously. The side effect includes difficulty in sleeping, an increase in blood sugar level, and changes in mood. Targeted therapy such as monoclonal antibody therapy uses rituximab and nivolumab to treat newly diagnosed or recurrent primary CNS lymphoma. Besides that, tyrosine kinase inhibitors such as ibrutinib also treats newly diagnosed or recurrent primary CNS lymphoma. Chemotherapy is usually the first treatment given to treat high-grade lymphoma. Cancer-fighting drugs are injected into the patient's body through the vein. Regimen consists of drugs that mostly cross the blood-brain barrier. High dose of methotrexate is prescribed by IV drips over a few hours. Other drug treatments such as sodium bicarbonate and folinic acid are also given during chemotherapy. This helps to reduce the side effect of methotrexate. Other treatments such as high-dose chemotherapy with stem cell transplant is used to replace the blood-forming cells that have already been destroyed by cancer treatment. The second treatment will be a clinical trial of a new drug. Patients who have recurrent primary CNS lymphoma can undergo a clinical trial of a new drug. The third treatment will be intrathecal chemotherapy. If the primary CNS lymphoma is found in the eye, intrathecal chemotherapy is used. where anti-cancer drugs are injected directly into the vitreous humor of the eye.
CNS lymphoma is a rare and aggressive central nervous system neoplasm with high morbidity and often fatal outcome. It is more common in men and elderly persons, most frequently encountered in elderly, HIV-positive, and post-transplant populations. Individuals who have weakened immune system or autoimmune diseases are high risk of having CNS lymphoma. Computerized tomography (CT scan) and magnetic resonance imaging (MRI) scans are often used to diagnose. Missed or delayed diagnosis can lead to mismanagement and treatment delays. Several treatment options are available according to different conditions. It can be cured by strictly following doctor's instructions.